Facebook. And we start recording the proceedings.
Okay.
Yeah. Very good morning, all of you. We are here on the third day of our National Pharmacy Week, 59th National Pharmacy Week. We have started on the 17th. Yeah, actually, there is a technical. Welcome all of you to Alwar Pharmacy College National Pharmacy Week celebrations. And today we have among us Dr. Monica Jain, who is the professor in Department of Pharmacology. She has so many publications and presentations on her credit, and she is now in the SMS Medical College, Jaipur. She is in the pharmacology department. She is also the chairperson of RCA Pharmacy. I got the opportunity to work with the aegis of Dr. Monica Jain for 2 years in RCA Pharmacy for getting admissions of the students in Rajasthan University of Health Sciences, centralized admissions. So she is a very nice human and very good teacher, very good researcher. She is always surrounded by students and research scholars. If you get a chance to meet her in our office, you will realize this. My words are not exaggerating or something like. So I would like to have Dr. Monica Jain to talk on our APC online convention long back, but somehow we missed her. Now we got the opportunity to have to hear Dr. Monica Jain on the topic, especially the drugs used in COVID-19. And I asked Ms. Neha Sharma to moderate the session. I request now I hand over the session to Mr. Neha Sharma to recite the biography of Dr. Monica Jain and request her to start the lecture. Thank you, Varunad. Thank you, Dr. Monica Jain. On my behalf and on behalf of Alwar Pharmacy College, its management, staff, and students. Thank you and welcome, Dr. Monica Jain.
Thank you so much, sir.
Thank you, sir.
Over to you, Neha Sharma.
Thank you, sir. Good morning, all of you. Welcome in a 15th 9 National Pharmacy Week Celebration 2020. First of all, I would like to thank Principal Sir for giving this opportunity to introduce our special guest speaker, Dr. Monica Jain, ma'am. Welcome, ma'am.
Thank you, Neha.
She is presently working as a senior professor and HOD of Pharmacology Department, SMS Medical College, Government of India. She has done MBBS from GLN Medical College, Ajmer, and MD in Pharmacology from RNT Medical College, Udaipur. She has a membership in Indian Journal of Pharmacology and the Rajasthan Medical Journal. She is Assistant Coordinator of Pharmacovigilance and member of Institutional Ethics Committee. She is a member of PG Research Review Board and resource faculty of Faculty Training Program. She is actively involved in organizing many conferences, symposiums, and workshops in the department. Today, she will present the views on use of antiviral drugs during COVID-19 pandemic. I welcome to Dr. Monica Jain, ma'am, on the behalf of Alwar Pharmacy College. Ma'am, I request, please start your session.
Yeah. Thank you, Neha, for my introduction. And I'm really thankful to the Alwar Pharmacy College for giving me this opportunity to talk on a very pertinent, burning topic of COVID. Because a lot of issues were being raised right from the treatment of COVID. I have to talk about COVID in a holistic manner, but I will be touching more on antiviral drugs which are currently used. But overall, I'm going to give you a holistic view about the COVID. So as everybody knows, we call it as COVID. I'm audible to all?
Yeah, ma'am.
Yes, ma'am, you are audible.
Okay, thank you. So what I'm saying is that we already know what is COVID. CO stands for coronavirus, VI stands for virus, and D stands for disease. And 19 word was given because it was discovered in 19. So on 17th November, only the first case in 2019 was unofficially uh, discovered, unofficially declared तो नहीं कह सकते इसको, but it was first came into limelight in China, in Wuhan city, which I will be telling you in my slides also. I'm just going to share my slides. And what I want to say about this Corona 19 or COVID-19 virus is one of the influenza virus. Previously, we had MERS, Middle East Respiratory Syndrome, and acute respiratory distress syndrome. That is, this is called as SARS-CoV-2. And previously, we had the similar kind of influenza virus, which was called as SARS-CoV. Screen is not being shared. PowerPoint. तो PowerPoint नहीं share करना. ये रहा ना, ये रहा. So what I want to say today is that this is a type of influenza virus with much of the infectivity and contagiosity. And so in initial phases, we tried drugs which we had hand-on experience with, which was used for SARS-CoV-1 and the MERS, that is middle respiratory distress syndrome. So I'll just talk about a little introduction in my lecture, and then I'll be telling you the actual drugs which are working around. And you must be aware that after Diwali, the boom is have already come in Jaipur about this corona infection, and there is no place left in any of the hospitals to get the patient moderate to severe get admitted and with the oxygen supply. So, let me tell you that are you able to see the screen of
Yeah,
the
ma'am.
presentation?
Presentation is clear, ma'am.
In the presentation?
Yeah.
Yeah.
Slideshow is on.
Okay. So as already the introduction of mine is given in a very sweet manner, I'm not that type of a stranger person, but I'm a normal human being. And now this COVID-19, as I told you, CO stands for corona, VI stands for virus, and D stands for disease. And this disease was called as the coronavirus or COVID-19, which means this, which I have already explained. And as I told you, it was discovered in 17th November 2019. So abhi anniversary jaake hi chuki hai, and it was discovered in 50-year-old citizen in Mumbai provinces in China. If you see the fact sheet of COVID-19, it is transmitted through human to human through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. This is very, very important to note that it is transmitted through droplets of saliva or discharge from nose. Because when we are going to talk about how to prevent it, we are going to talk upon preventing the droplets of saliva or discharge of nose to be touched by our fingers or transmitted to nose, throat, etc. So we have to be very careful. Incubation period is about 1 to 27 days, and the recovery time usually taken is 3 to 6 weeks. So this has to be noted. If you talk about the clinical picture, you have now please let me tell you, there are variability of clinical feature. Some persons, they do not have fever, they may have only mild myalgia. I am one of the person who has suffered from COVID, and let me tell you, I was fortunate enough that I had only 1 day myalgia with fever, that also mild degree. But here in cases of fever, in some persons they may suffer from mild fever, some may suffer from high grade persistent intermittent fever. It may be persistent or intermittent also. So fever is most common complaint in 77 to 98%. Then cough is another complaint, which is dry cough, and the feeling is of having something sticky thing in the throat, so that leads to dry cough. There will be myalgia or fatigue, which is the third most common thing. There will be loss of smell, loss of taste. So the sweet taste is gone. Even the dal will not look like dal, will not be felt like dal. Your taste buds have gone. You cannot even smell the sanitizer smell. This is the typical feature I was having: loss of smell and loss of taste. There can be shortness of breath, 3 to 31% if it is occupying the lung. But the most common picture which I am going to talk is that they are having fever, persistent high grade fever, cough, body aches, runny nose, shortness of breath, sore throat, loss of smell, loss of taste. This is, and loss of smell is called as anosmia, and loss of taste is called as ageusia. So these are the important primary symptoms which you need to recognize. If any one of us have any of the one or two features, we have to undergo COVID tests so that we are not the transmitter of disease to other person. Now, if you classify the COVID-19 patient clinically, asymptomatic means that I was in contact and I was not having any symptoms, no fever, no myalgia, nothing. But I have, because I was a healthcare worker or my family had some member, or I thought that in my close proximity there are many persons who are COVID positive, let me undergo RT-PCR. When it was done, there was no symptom. The X-ray chest also was normal, but RT-PCR was positive. So these are cases without any symptoms. Then mild, in which again RT-PCR is positive, but there is upper respiratory infection, fatigueness symptoms, fever, GIT, and the CT score. If you do it, CORAD scaling is there. It is a 1 to 2. If you undergo HRCT, they are going to tell you their score 1 to 2. So mild, when the situation is mild, it is 1 to 2 scoring, CORAD scoring. When we talk about moderate, then it is pneumonia which has developed. There is no hyposaturation, that is oxygen levels still do not fall to this alarming level, and CT score is CORAD is then 2 to 3. If we talk about severe, then there will be pneumonia with hyposaturation, and here the SpO2 falls less than 92%. Then these are CORAD score 4 to 5. That means they have entered a severe situation. And critical means acute respiratory distress syndrome with shock, encephalopathy, heart failure, coagulation function, acute kidney injury. All these things are critical, which is life threatening. So please, you have to be very, very careful in patients who are elderly, patients who are having comorbid condition, patients who are diabetic, patients who are hypertensive, patients who are having limited kidney functions, or they are chronic kidney disease patients, patients who are anti-cancer drugs, patients who are on immunosuppressions. A lot of things have to be kept in mind. That is why I've taken that slide, that how do you classify the patient. Now, what are the drugs which were used up till now? Now, this is a Times of India paper cutting in which, in very short summarization, the drugs which are used to treat the COVID infection is being given. Here, if you start with the remdesivir, I would like to say this is the only drug which is working nowadays, especially in Jaipur. Whenever the case is from moderate, even mild to moderate, we have started giving remdesivir, because we have seen patient deteriorating, asymptomatic patients becoming mild, and then they are deteriorate like anything. So remdesivir is the answer to those kind of patients. Even if their SpO2 is normal, we are giving it. And the category is that this remdesivir is antiviral. I will talk in detail, and I will tell you how does it act in detail with the diagrammatic representation. But in nutshell, this drug is actually inhibiting the viral replication in the body. So it is given in hospitalized patient, but I'll tell you now, because the wards are full enough, what has been done is the patients are given this remdesivir injection, which is taking about 45 minutes to 1 hour, slow intravenous injection, first day 200 milligram dose and the next day 100 milligram. So this loading dose of first day has to be given very slowly. Every time it has to be given very slowly. So now the patients who have this moderate category infection, they are also making the hospitals give them the remdesivir, and they go back to the home in the home isolation. So this has been done on a new aspect. Previously, when the cases were less, it was only in hospitalized patients. Then categories of drug include glucocorticoids. And why glucocorticoids are there? Because they are very potent anti-inflammatory agents. And let me tell you, in COVID, what happens is The COVID is going to disintegrate the porphyrin from the heme, and a lot of ferritin is being secreted. Ferritin is secreting. So ferritin is a marker which is going to increase, and this high level of iron will be absorbed by the macrophages, and the storage of iron in form of ferritin also increases, and the extra iron is being phagocytized by the macrophages, and they are going to then stimulate and release lot of cytokines, interleukin 1, 2, 3, 4, 5, 6, interferon beta, tumor necrotic factor alpha. So all of these things are being addressed by glucocorticoids. So Dexona has to be included. If we see the interleukin level has been raised, serum ferritin has been raised, all of these inflammatory markers like C-reactive protein has been raised, D-dimer has been raised, you have to start the Dexona, which is most important to start on the correct time. Then another antiviral drug was favipiravir. The difference between remdesivir and favipiravir was that remdesivir has to be given parentally, while favipiravir came in an oral tablet form. Previously, there was the strength of the tablet was 200 milligrams, so the person has to take 18 tablets on the first day, which was very cumbersome job. Now, Glenmark, thank to the Glenmark who has made 400 milligram of the tablet. So 4.5 tablet in the morning and 4.5 tablet in the evening will solve the purpose. So this is a oral antiviral drugs, and it is a broad spectrum antiviral, and it also acts by selectively inhibiting the RNA polymerase, which we are going to talk in detail, because my essence of the lecture is to focus on remdesivir, favipiravir. So I'll talk about this, but in general, I need to give you a holistic view, so I'm discussing each drug. Tocilizumab is another drug which is a monoclonal antibody. It is approved, and it is interleukin 6 antibody. So it is going to inhibit the interleukin 6, which is released in cytokine storm. So this cytokine storm is being inhibited, and it has to be indicated in moderate to severe disease. Here also this is given parentally. The role of convalescent plasma was initially felt, it was initially approved by ICMR also, but nowadays again when the evidence has started lacking, people are not having a very encouraged theory to use convalescent plasma, because the evidence does not correlate with the efficacy. So in some persons it may respond, but yes, it has to be given, it has a particular COVID positive patient with 2 COVID negative reports previous, their plasma can be used, and it will give the antibodies to fight against the plasma from the recovered patients. Hydroxychloroquine and chloroquine has very interesting story inside. Hydroxychloroquine and chloroquine, they are basically alkaline drugs. So initial regime, if you all agree, was to give azithromycin along with hydroxychloroquine. This and hydroxychloroquine as a prophylaxis was also given. So I would like to say that hydroxychloroquine and chloroquine have 2 important role to play. What they are going to do, they are going to primarily go inside the plasma membrane where the virus is lying, and virus, whenever the virus is penetrating a plasma membrane, it is going to penetrate through its S protein, which is called as spike protein, and there is a receptor which is called as ACE2 receptor, through which it gets attachment, and this invaginate into the plasma membrane. When the invagination occurs inside, it turns into endosome. So chloroquine, by entering into the cell, will prevent the endosomal pH to remain acidic. It turns it to an alkaline. Similarly, endosome is fusing with the lysosome to produce endolysosome. This endocytosis and endolysosome formation is required for viral protein uncoating, and so it can replicate after it is getting free. But if the pH is alkaline by the hydroxychloroquine, it will not be able to help. So first mechanism of action is this, that it is going to inhibit the processing of endosome formation to endolysosome formation, and also it will also cause influx of zinc into the cells. Usually zinc does not penetrate easily, but this hydroxychloroquine, chloroquine will act as a basket to pull up the zinc into the cell. and zinc will inhibit the RNA-dependent RNA polymerase, which is required for synthesis of viral replication proteins. So these are the way hydroxychloroquine was supposed to act. A combination of azithromycin and hydroxychloroquine was very effective, especially in Indian context, but it was being turned down by other FDA sites. Why? Because they have seen the safety issues, that there were Tordis D pointis in patients who have heart disease and all. But still, at our center, these are the drugs which are effectively used still in mild cases, the hydroxychloroquine and azithromycin combination. And plain hydroxychloroquine was given to a health worker also successfully, and there is a lot of evidence that it had a prophylactic value also. Now we come to a quick look into this. I must tell you and request you that this is a beautiful picture of explaining what is COVID virus, where is the S protein. I'll just begin with showing with my cursor. This is a SARS-CoV-2 protein. It has the S protein, and this is the ASE2 receptor present on the nasal mucosa, on the throat mucosa, on the alveolar macrophages, alveolar cells type 2, and this gives attachment to the S protein. So the S protein gets the attachment through ACE2 receptors, which are present in nasal mucosa, in the throat, in the alveolar cells, in the heart, in the kidney. And then this attachment is also requiring one of the other protein, which is called as TMPRSS2, which is going to help in the penetration of the SARS-CoV-2. This has been inhibited by a drug, experimental drug, but it's called as chymostat mesylate. Although this is not used here, but this was a potential experimental drug which has preventing the entry of the virus cell. Now we are focusing here. I'll just tell you in brief how the life cycle proceeds. So once SARS-CoV-2 get the attachment, it will invaginate. When it invaginate, it is going to fuse with the lysosome and the endocytosis occur. All right. So I told you the endocytosis, invagination, endocytosis with lysosomal fusion is also inhibited by hydroxychloroquine, and also hydroxychloroquine and chloroquine have immunomodulator role. That is why we all know that it is being used in rheumatoid arthritis as a disease modifying agent. So it is going to inhibit interleukin 6, interleukin 2, 1, and it is also going to inhibit the migration of inflammatory cells to the site of injury. So now this is the mechanism of action of chloroquine and hydroxychloroquine. Now we talk about antiviral drugs. We have anti-HIV drugs like lopinavir and ritonavir. They are called as protease inhibitors, and they are, as I told you, here there is uncoating of the viral this virus, and this uncoating will release the RNA. RNA will undergo into translation into polypeptides. A polypeptide is a big molecule, so it has to be broken by the process of proteolysis into non-structural protein, and this requires the enzyme, that is chymotrypsin like proteases. So this has been inhibited by the other antiviral drug which were conventionally used to treat HIV, that is lopinavir and darunavir. At present status, if you'd like to ask me, what are we using lopinavir and darunavir or ritonavir plus lopinavir anti-HIV drugs? No, they are not found to be very much effective as compared to the other drugs. So we are not much interested now. Now this proteolysis will give rise to non-structural protein, and the non-structural protein then will be acted upon another enzyme which is called as RNA-dependent RNA polymerase, which is also in short form called as RDRP, and this will give rise to synthesis of RNA, which will give rise to further structural protein, then assembly, and finally the exocytosis of a new viron is there. Now your drug which is acting on this step, that is RNA dependent RNA polymerase, are the drugs which are now being used with great efficacy. And out of all three drugs which I am showing you, ribavirin, remdesivir, favipiravir, most important is the remdesivir, which is very much up in the market, and it has been manufactured by Gilead, and favipiravir is also been manufactured by Glenmark. So in Indian protocol also, admitted patients are being given remdesivir, and moderate cases, mild to moderate cases, can be started with the favipiravir. So this is a pictorial diagram which will show you that how the drugs are being acted. Here you can see a drug which is called as tocilizumab and cerulopram. This will bind to interleukin 6. As I told you, whenever the macrophages is being stimulated, it is going to release lot of interleukin cytokines, all varieties. So interleukin 6 is most deleterious. So interleukin 6 is being captured by a drug which is called as tocilizumab. So this is how the tocilizumab acts. So now we'll start with in detail about remdesivir. So remdesivir is an intravenous nucleotide prodrug of adenosine analog. We already know that the RNA is formed by adenosine, guanine, uracil, right? So cytosine. So these are the three nucleotides which form the RNA component of the coronavirus. Coronavirus is an RNA virus. So remdesivir is a nucleotide prodrug of adenosine analog. That means it is not adenosine, but it is resembling. उसकी शक्ल adenosine से मिलती है. So the remdesivir is binding to viral RNA dependent RNA polymerase and will inhibit the viral replication through premature termination of RNA transcription. The dose advised is 200 milligram OD. As I told you, it comes in a lyophilized powder which has to be reconstituted, mixing with normal saline, and then you have to give it very slow intravenous injection because the injection is very painful. So 200 milligram intravenous OD day 1, followed by 100 milligram intravenous OD for 2 to 5 days. And average cost of therapy is in Indian rupees is 30,000 approximately. One vial of 100 milligram comes as 5,000 Indian standard rupees. So the cost is of the total 5-day treatment using only remdesivir is about 30,000. So this, I hope this clears what is remdesivir. So if I'll tell you in a pictorial diagram, you will realize that remdesivir is a drug which is converted into its active metabolite, is a prodrug, and this active metabolite is called as GS441524. And as I told you, this is coronavirus. It is getting attached to ACE2 receptor. This will undergo a process of endocytosis. This endocytosis is going to fuse with the lysosome to produce endolysosome, and in the similar form, this is another diagram. So remdesivir is a prodrug with esterases is broken down into this metabolite, and by this kinase it is again converted into further active metabolite. This will do what? This will actually resemble the viral RNA, the viral RNA which is decoded, and it will itself get integrated with the viral RNA formation. This transcription will give rise to a faulty RNA in cooperation of GS441524, which will be inactive. You got my point? So this is most important, that because it is an adenosine analog, it will itself resemble by the RNA dependent RNA polymerase as one of the adenosine, and will be incorporated in forming a defective RNA, defective viral RNA, which is non-functional. So this is how the remdesivir act. Now, important thing is, should we start remdesivir right in the asymptomatic patient or mild patient? No. It has clear-cut indications, like in hospitalized and required supplemental oxygen cases who does not require oxygen delivery through a high flow device, non-invasive ventilation, invasive ventilation, or ECMO, can be given remdesivir, as I told you, 200 milligram for the first day, diluted in normal saline, followed by remdesivir 100 milligram once daily for 4 days or until the hospital discharge, whenever come first. Then remdesivir can also be added upon with other drugs, like with dexamethasone, which will take care of the cytokine storm, 6 milligram intravenously, or or orally for 10 days or until the hospital discharge, whichever come first. If remdesivir cannot be used, dexamethasone may be used instead. So this is the guideline which is telling you when to use remdesivir. Then in hospitalized and requires oxygen delivery through high flow device or non-invasive ventilation, dexamethasone plus remdesivir at doses and duration above the this is given, and dexamethasone doses and duration discussed above in A1 is to be given. So in nutshell, I just want to say that remdesivir is required to be given in moderate to severe cases. Nowadays, what the trend is, if there is saturation of oxygen 94% and below, and the CORAD score is from moderate to severe, we have to start the remdesivir and with or without admission. Either we can afford to have a आउटपेशेंट सेटिंग में रेमडेसिविर लगवा के एंड वापस आ जाओ घर पे आइसोलेशन में रहो, या फिर इफ द हॉस्पिटल हैज अ आइसोलेटेड रूम विद ऑल फैसिलिटी, you can get admitted and take the drug. Adverse effects are nausea, and we have to be careful about the like in some of the areas it was like, written that causes transaminitis. That means increased liver enzyme. If you want to understand in easy language, it increases the liver enzyme. ALT and AST, which are part of it, there is elevation. There can be hypersensitivity in susceptible individual. Increase in prothrombin time is another side effect. Now, very important effect is that in moderate or severe renal function, there can be renal toxicity because of a very important vehicle by which the drug is being prepared. It is called as SBECD. Please remember this. S stands for sulfo, B stands for butyl, E stands for ether, B stands for beta cyclodextrin. So this SBECD, it is associated with the renal toxicity, and this may accumulate in patients with moderate or severe renal impairment. So a patient of moderate to severe renal impairment cannot be given this remdesivir because of the drug vehicle, which is SBECD, sulfobutyl ether beta cyclodextrin. So if you say in what amount it is present, so in 100 milligram of RDV, that is remdesivir lyophilized powder, it contains 3 gram of SBECD, and each 100 milligram per 20 ml vial of RDV solution contains 6 gram of SBECD. So these all, why I am taking this lecture, because you will find n number of things which can be talked about everywhere, but nobody is going to talk you about minute detail what cautions we need to require in the patients who are treated with remdesivir. And we all should be aware about what are the side effects, why there are side effects, why it has to be compromised in renal patients, right? Then we come to monitor parameter. As I told you, there raises the ALT, AST. So you have to monitor hepatic function. You have to also monitor renal function because of the vehicle use. Prothrombin time should be monitored before and during the treatment as clinically indicated. Not recommended. Please note, if it is GFR is less than 30 ml per minute, remdesivir may need to be discontinued. ALT increases greater than 10 times. So when you have to inhibit using it, you have to see that if it is greater than 10 times ALT raise, you have to stop the drug. Or any other signs of liver inflammation is there, you have to stop the drug. Drug-drug interaction is minimal or no reduction. Let me tell you, because we are very fearful using two drugs together, whether any drug interactions are there or not. So you can safely use this drug with dexamethasone. Okay, there is minimal or no reduction. But how about with hydroxychloroquine and chloroquine? This they may decrease the antiviral effect of RDV. Now the question is why they are decreasing it. The reason being, जो उनका active conversion होता है RDV का into its active metabolite, the processing of that activity is being inhibited by chloroquine and hydroxychloroquine. So co-administration of these drugs are not recommended. Similarly, prothrombin or with oral contact anticoagulant. What is the particular oral anticoagulant used? It is rivaroxabarin, oral anticoagulant. In admitted patients, we prefer to use parenteral, that is enoxaparin. But in case patients where they are treated at home with favipiravir, we can start with rivaroxabarin. But if there is remdesivir, there will be increased chances of bleeding. So that has to be kept in mind with oral anticoagulants and RDV. Then this is favipiravir. As I told you, this favipiravir is also an antiviral drug. This undergo ribolization and phosphorylation. That is, this is called as ribofuranosyl triphosphate. As I told you, this favipiravir is what? It is going to convert, undergoing the process of ribolization and phosphorylation. Thereby, it is converted into its active form, that is RFTS, ribofuranosyl triphosphate. And this will again inhibit the RNA-dependent RNA polymerase, and so it will inhibit the viral replication. So this is the same kind of drug, but it itself undergo ribolization and phosphorylation to convert into active metabolite, but it is going to act on the same site as the drug remdesivir was active. So now this has to be given. Initially, it was a troublesome feature to start using this drug, because 18 tablets were to be taken by the person's 200 milligram each strength for the tablet. Now Glenmark has put a 400 milligram version in which the patient needs to consume 9 tablets on day 1, that is 4.5 tablet in the morning and 4.5 tablet in the evening, and thereafter 2 tablets twice a day from day 2 till the end of the course. The course can occur for 10 to 12 days, and it also depends upon the patient condition. So please remember the dosing, which is very important. 409 tablets, 4.5 tablets morning, 4.5 tablets evening, and thereafter 2 tablets twice a day from day 2 till the end of the course. Adverse effects, a very important adverse effect. Let me tell you, one of my relatives with all good reports came with a worry in the mind that because the uric acid level, which was previously with normal range, raised to like 12 or 13, and this is a side effect of the favipiravir. How it is going to do? It is going to inhibit both way, inhibit the excretion and inhibit the reabsorption, increase the reabsorption of uric acid. So it is going to inhibit the excretion and increase the reabsorption of the serum uric acid, thereby causing increased serum uric acid level. Now question is, what has to be done? In a normal person, continue to give favipiravir the whole course, but in a person who has gout, we cannot give this drug further. We have to withdraw and substitute it with remdesivir. Okay, so that is very important. Diarrhea can be another important fact. Decrease in neutrophil count, raised liver transmissions, this effect also, and remdesivir effect also. Psychiatric symptoms can another be side effect. Monitoring parameter, of course, will be uric acid level, liver enzymes, blood count. There should be no neutropenia. Clinical symptoms of abnormal behavior like acute delirium can be there. Drug-drug interaction is, you have to be cautious when you use favipiravir with below mentioned drug like pyrazinamide. Blood uric acid level decrease. Repaglinide, blood level of repaglinide may decrease, causing hypoglycemia. Theophylline, blood level of favipiravir may increase, and Works reaction to favipiravir may occur. And famciclor and sulindac, efficacy of these drugs may be reduced. So you have to watch for drug-drug interaction too. Other drugs which I told you was lopinavir, ritonavir, and HIV protease inhibitor. Lopinavir and ritonavir are given together, and they were going to prevent the replication of SARS-CoV-2 because they are going to inhibit the cleavage of polyprotein into smaller component, which will be converted into further structural proteins of the SARS-CoV-2 virus. So these two proteases which are responsible for cleavage is being inhibited by lopinavir and ritonavir, and these two proteases are chymotrypsin like proteases, 3CLPRO, and papain like proteases. So if the polyprotein is not break down into smaller protein, viral assembly, viral protein formation, structural protein formation will not occur. So this is how these lopinavir and ritonavir is acting. Initially, they were very potent drug thought to be, because they had an experience for being used in Ebola virus, in cases of SARS-CoV-1 infection. But here then better alternatives were there, and their efficacy was not very much proven. So now we are switching over to remdesivir. The parameter, we have to take HIV antigen antibody test as a baseline, serum transmitters levels, monitoring ECG when LPV, RTV is given with the QTC prolongation medication. This is very important. Adverse effects is nausea, vomiting, diarrhea, QTC prolongation, and hepatotoxicity. They are potent inhibitor of cytochrome P453A. So the drugs which are metabolized by this enzyme should be used with caution because their levels may raised. Now we come to the adjunct therapy. Lot of things have been told by Ayush and the yoga persons and the antioxidants and the lifestyle modification and the respiratory exercises, which are all very useful in a routine practice also. But when we talk about adjuvant therapy, vitamin C has an antioxidative role, vitamin D has a role. Why? Because it will release nitric oxide. Let me tell you, in coronavirus, the important thing is a last stage disease in which multi-organ failure occur, and this all occur because microthrombi formation occur in smaller blood vessels, and they are being blocked, and because of this blockage, lung is injured, heart is injured, kidney is injured, and so this is called as multi-organ disease failure. That is why antithrombotic drugs are being used to prevent the thrombosis from being from being formed, because there are a lot of inflammatory markers which are causing a lot of cell injury, which will stimulate the coagulation cascade and will lead to thrombus. So vitamin D is going to act in a way that it is going to increase the blood supply by release of nitric oxide, and plus it has immunomodulatory properties. So that is why a prescription of COVID positive patient with even mild to moderate, you will find vitamin C, vitamin D, you will find zinc supplement. As I told you, zinc supplementation usually causes what? It is going to decrease the activity of RNA dependent RNA polymerase. So there will be no translation. So zinc is important. Low molecular weight heparin and antiplatelet. I told you low molecular weight among this enoxaparin is most important drug which is there. Subcutaneous administration is being done. Then statins has adjuvant role to play in some of the research articles. Although as a standard protocol, we are not using at our center. And also AC inhibitors, ARB blockers, they are also not being used. Non-steroidal anti-inflammatory. Now a word about this. Let me tell you my experience with my relatives and other patients. Clear cut indicates when the fever is high grade and we give even 650 dolo, it is not responding. So you have to give a combination of MCR, that is, it is quite effectively reduced by mefanic acid plus paracetamol. Another drug which is found to be very good is the eosinophilic plus paracetamol. Another drug which is very good in reduction of temperature can be Sumo, combination of nimesulide plus paracetamol. Because these viral fevers, they are very resistant to get down. So if the person, instead of taking 650 milligrams, not able to reduce the fever after 2 years even, then you have to think about some other drug, which I told you. My personal experience, mefenic acid plus paracetamol was wonderful. Many people are using here as a protocol. Then COVID-19 convalescent plasma is an early intervention only. If the already cytokine storm has started, nothing, this is not going to work. Another combination which is nowadays given in mild cases is hydroxychloroquine and ivermectin. Ivermectin has a broad spectrum antiviral activity, and ivermectin has found in cells, in HEPA cells, 5,000 times reduction of the COVID virus load experimentally, and it also prevents the viral replication. Plus, what it does is, now please listen carefully because you will not find this mechanism anywhere else. Usually, our host in which the virus invade, the nucleus and nucleus with its chromosome have the antiviral property inside. But what ivermectin is doing? Ivermectin is penetrating the nucleus of the host cell. How it is doing? By a transporter which is called as importin. So ivermectin will go and get attachment to importin, which is present in the cytoplasm, which is a component of virus only. And this important with ivermectin is going to penetrate inside. If ivermectin is not there, they are going to penetrate inside and decrease the antiviral property. But in presence of ivermectin, this importance are being inhibited. So if they are inhibited, they are not going to penetrate the nucleus of the host cells. And if they are not able to penetrate the nucleus of the host cell then start defending the virus by producing antiviral agents. So ivermectin endorses the immunity of host cell by nucleus and the chromosomes, which are going to produce antiviral agents. So it is going to inhibit important which is transporting inside the virus and inhibiting the antiviral property of the host cell nucleus. Hydroxychloroquine I already explained. So nowadays the combination is ivermectin plus doxycycline. Ivermectin 12 milligram BD and doxycycline 500 milligram BD is to be given for 5 days in cases of mild to moderate cases of virus. Then these are COVID prevention method. I have taken this opportunity to just tell you that you have to wear a mask. Mask is the only vaccine which is available for us, because till now vaccine is upcoming. Moderna vaccine is there, which is messenger RNA vaccine. Let's see what is the effect. But till now the fingers are crossed. So for now you have to just carefully wear very protective mask. Just wearing a gamcha or wearing a scarf or wearing a thin layered cloth will not suffice, because whenever there is expiratory blast of the through nasal secretion, it is surely going to enter. So you have to avoid that. So you have to wear a competent mask. Then you have to avoid touching your own eyes, and this I had a very bad habit of doing that. I'm trying to prevent it. You have to avoid the high risk area and the crowded places. You don't have to go to Gorata or any other places where you of choice and do a shopping. Don't do shopping for few more months. Stay home. This is the most important thing. If you stay home, you will be not getting the infection. Plus you are infecting, you are not transmitting the infection. You have to eat hot foods. Hot foods are always good. And washing hands is a very good practice. I will again endorse that. Instead of using sanitizer, if your water and soap is with you, it is better always to use the water and soap. Take home message: a mask is better than ventilator, and it's the only preventive measure till the vaccine comes. Home is better than ICU. It is not a curfew, it is just care for you. So with this I am going to end my talk of today. Any questions, I will be love to answer that.
Thank you very much, ma'am, for your deep insight on the treatment protocols on COVID-19 infected patients.
Yeah.
And it was very great thing. If a person can speak the pathology and pharmacology together, it will be very important talk for a pharmacist, especially. Yeah. He can understand the core of the science, as well as he can go for getting the right treatment from the places where they are going for treating their COVID diseases. So this is a very good insight. I like to say that this is a very important presentation. As far as I have heard from so many people, we were talking about the role of pharmacists, role of our duties, responsibilities, opportunities. This is a different dimension, different view. This is what we expect from a pharmacist nowadays. What we pharmacists have to serve to the society should be in this aspect only. They have to understand the science, how the virus getting into the body, and how the drugs are working to attenuate the effects of the virus. This is a very great presentation, ma'am. We are very much impressed upon this. Thank you very much for your detailed presentation, and we are indebted to you all together from Alwar Pharmacy College on my behalf. Thank
So
you very much, ma'am.
even I want to convey my thanks to the patient listening, which you people have done. And any of the queries, I will share my presentation if you like, sir, to
Yeah,
your mail
ma'am.
address if you want. And I am actually waiting for other future endeavors of the topic of your interest, which I can participate whenever you will.
Yeah, ma'am. Thank you, ma'am. Thank you for your proactive commitment, and we are very much pleased to have you in our further sessions also. And
Give me an invitation.
I,
Just to pray to God that this COVID should end up on. And wonderful seeing you all again. And I'm really thankful, because that is the only thing which has kept me going in spite of my diseases which I was suffering from. So let me tell you, COVID was not, I actually was a winner over COVID, and COVID could not do anything to me because my mindset was very strong and concrete, that what I have to do and what I have not to do. So I just want to end up my talk by saying that please don't get contracted with corona. If you get contracted with corona, please do not spread. That is most important message I will like to give. Be very honest to yourself. If you have any symptoms of sore throat, even mild myalgia, go for corona testing. And the moment you realize, isolate yourself. Hiding corona is spreading corona. So with this, thank you very much, Neha. You are being very sweet in managing and talking to me. You all people, I'm able to see few of them. And yes, it's very wonderful to talk to the intelligent audience like you all. And I'm really waiting for the next opportunity whenever I'll be getting. I'll be surely,
sure.
it will be lovely for
One,
me to
one,
deliver a talk. Thank you so much.
one question has been typed by one of the students, Swati
Yeah,
Suryavanshi.
yeah,
Recent news came out from Russia that in Siberia, mutation occur in COVID.
yeah.
So my question that how can mutation occur in COVID, as in the treatment of COVID, there is no radioactive agent, and if it occurs, it can be dangerous.
So the point is, not much work, to be honest, has been done in India about mutant virus. We were actually talking in some papers about mutation is possible. There was a study in Gujarat where they told ki this coronavirus cannot be mutated. So how much this Siberian virus has undergone mutation uh, is a question of doubt, because you see every second day an agent or a vaccine or any of these such things are being in the air, that this is effective, this is not effective. Then all, even our news was that this is not a virus, this is a bacteria, this is a scam. So we don't have to believe on localized news, so we have to use our judgment. So in Gujarat there was a study whether mutation is possible or not, and they have worked upon this coronavirus, and they have said that it cannot be mutated till now. This is the news with me, authentic news. Rest I have to search for.
Thank you very much, ma'am. And what are thoughts about vaccine manufactured by Pfizer?
We are anticipating that this Moderna vaccine, which is set to come by this December or most probably the next year, January and all,
Yeah.
and millions
This,
of copy have already been done. See, any of the vaccines, because the last day only, I was reading that there was 3 important adverse effects with this drug, because it is still in trial, phase 3 trial. So, there were very sore arm, myalgia, severe myalgia, and fever was also there. So all 3 effects were there, done, adverse effects were being reported by the Moderna vaccine, which is under development. So this is an mRNA vaccine. So I think this mRNA vaccine is good as compared to the DNA vaccine or other passive immunity we are talking about, because here the virus is not needed. This drug, this type of vaccine will make human as factories for the good immune cells which are going to control the virus. So it's very hopeful thing that a vaccine is on the way, and not much adverse effects are being reported except the 3 which I mentioned. But see, in this era nothing can be predicted. Let it come, and then only we'll be able to say it will be effective or not. As compared to other vaccine, yes, it is supposed to be quite effective and safe.
Yeah, thank you, ma'am. And you are talking about almost all the drugs used in different protocols, and you are also talking about favipiravir. Favipiravir is introduced by Glenmark in India,
Yeah.
and I am proud to say that the one scientist from Glenmark side in the participation of this clinical study is Dr. Vinayak Sapakal, who has completed his PhD under my guidance
Oh,
in
wow.
Alwar.
Great.
So I am proudly sharing this thing to everybody. Dr. Vinayak Sapakal is
Okay.
one of the key man there in Glenmark, Ahmedabad. Sorry,
Wonderful, sir. That is why the
Mumbai.
patient
Sorry.
compliance has increased from
Yeah,
18 tablets to 9 tablets is very wonderful effect because of the 400 milligram composition, which
yeah.
was set in by Glenmark. Wonderful, sir.
So
My whole appreciation for you and your student.
yeah,
Great.
thank you, ma'am. Thank you. And I'd like to request now Nega Sharma to say a lot of thanks to ma'am and conclude the session.
Thank you so much, ma'am, for a wonderful session and sharing your expert opinion on the topic on the antiviral drugs during COVID-19 pandemic. Thank you so much, ma'am, for giving your valuable time with us.
Thank you, Neha. Thank you so much.
Thank
Sir, the last part, Jay Balan, sir, I would like to say, when you are going to invite me to eat that idli, samar, the South Indian style, when you
So
are going to call me to Albert, sir.
as soon as the COVID is over, ma'am, they
Very
are
good answer.
eagerly waiting for
Correct
that.
answer, sir. So nice being with you, all of you. Thank you so much.
Thank you. Thank you.
I just want to add my resident, Dr. Anil, and my one of the faculty member, Dr. Shivankan, has helped me through this presentation. And I'm so much thankful to them also. So
Yeah.
nice meeting all of you. God keep you safe and healthy. Stay away from Corona and help the people who are suffering from Corona in a safe manner. Okay,
Thank you. Thank you very much. Thank you.
Thank you, ma'am.
Thank you. Ma'am, you may please leave the meeting. And now I hand over the session to Dr. Gurpreet Singh for the second lecture. I think Dr.
has joined. Yes,
Dr. Jayesh has joined. Welcome, Jayesh, Dr. Jayesh Dwivedi, Principal of Pacific College of Pharmacy, Udaipur. Am I audible to you, Dr. Jayesh? Welcome to Alwar. Welcome back. Please unmute. Yeah, we have to unmute him because.
Good morning, sir. Good morning, Dr. Jayabalan, sir.
Pranam, welcome.
Thank you, sir. It's always like a blessing if you call me. So
this time I requested my teachers to call everyone. So
no. It's like me coming back home back. Isn't it?
Yeah. Just 2 minutes back, ma'am was asking about when are you going to serve us idli. So we are keeping ready the idli for you. You are not coming.
No. I'll have it all together this time.
Yeah.
All the day.
Thank you. And please, Dr. Gurpreet, carry over the session.
Thank you very much, sir. Thank you, sir, for first of all, thank you, sir, for giving this opportunity to moderate this session. I, on behalf of Alwar Pharmacy College, welcome everyone to attend this session of third day of celebrating 59th National Pharmacy Week by our college. And here I'm going to recite the brief profile of Dr. Jayesh Dwivedi, sir. Let me share the screen so that I can share my slides to you. Is it visible to all?
Yes.
Okay, sir. So, Dr. Jayesh Dwivedi is currently working as principal and professor at Pacific College of Pharmacy, Pacific University, Udaipur. He is also currently sitting Vice President APTI Rajasthan State Branch since 2016, a dynamic professional, pharma professional, social worker, and young academic leader. He obtained his master's in pharmaceutical sciences from Mohanlal Sukhadiya University, MLSU, Udaipur, and PhD from Rajasthan University of Health Sciences, RUHS, Jaipur. He holds Green Belt in Six Sigma certification program organized by IIT Delhi. He holds more than 14 years of experience in academic and industry. He has published more than 25 research and review publications in national and international journals of repute and published 4 textbooks also. He has also supervised 5 PhD scholars, 10 MPhil students in various fields of pharmaceutical technology. He is associated with associations like APTI, IPGA in various serving capacities. Dr. Jay Trivedi believes that it's important to be a happy human first and foremost, and rest goals can be achieved thereafter. And here I'm mentioning one more thing. This is a very brief profile. Among his 5 PhD scholars, I am the one who, under his guidance, completed my PhD successfully. Thank you very much, sir, for your blessings, for your guidance, as well as Dr. Jayabalan, sir. Under his co-supervision, I completed my PhD last year. Thank you, sir. Thank you very much. And may I now request Dr. Jay Trivedi, sir, to start this session. First, I am slide out my sharing. Then Dr. Jay Trivedi, sir, will start his session. Yes, sir. Now you can start your session, sir, please.
Is it visible?
Yes, sir. Is it visible?
Okay, okay. And I am clearly audible also?
Yes, sir. You.
Okay, okay. So first of all, very happy National Pharmacy Week to each and everyone present here, as well as not present also, who are celebrating at their respective colleges the National Pharmacy Week in 2020. See, celebrating a National Pharmacy Week in pandemic itself gives a credibility to all the institutions, as well as to all the stakeholders, because where we are not able to organize the different aspects of the daily routine very normally, in such instances, to hold a National Pharmacy Week on using online platform itself, a very big congratulations to Jayabalan sir, to Alwar Pharmacy College, and everyone. Now, the topic was the theme basically for this National Pharmacy Week, the pharmacists are frontline warriors. So what I want to add here, that see, there are many talks already been taken on the topic pharmacists are frontline warriors. Why this is taken as the topic for this pharmacy week this year, because I always believe that pharmacists are anyways the frontline warriors throughout their life. It's not like if the pandemic has arrived and we are now recognizing it as a frontline warriors. We are frontline warriors, and I believe that we don't need a certification from anyone that we are frontline warriors. It's only that we must understand this thing, that we must be able to make people realize this thing, that we must get a proper what do we say, we must get a proper acknowledgement from the society. This is what I believe. Balan sir, if you agree with me, right now the government of India has taken a database from different nursing colleges regarding their staffs and their students, who the government thinks that they are the frontline warriors, because they are the people who will be the one who will be vaccinated the very first, along with doctors and all teams. But I don't think that government has taken any data from pharmacy institutions. Is it, sir?
Yeah, you are right. Actually, when we say frontline warrior, they say that who are going to meet the patients.
Exactly.
But patients are always in connection with pharmacists, and the government calculated pharmacies as business organizations, and they are not recognizing the services of the pharmacists, so they are not saying that pharmacists are frontline warriors. But real frontline warriors are pharmacists, because they don't know who is the patient, who is infected, but the people are coming to the pharmacist only at first, and they are
Absolutely.
facing the patients in the front line. They can understand, and we also in a position to reinstate that we are there to serve you people, so you can recognize us on our services.
But the government has still not taken the data of any pharmacy teachers or pharmacies.
No, it has been asked to Pharmacy Council of India. The government has asked the data of registered pharmacists from Pharmacy Council of India, and Pharmacy Council of India collected all the data from all the state councils and submitted to the government.
Okay.
So the data is there, but they are not separately saying the term pharmacist. They used to say physicians, nurses, and paramedicals.
Exactly.
So the paramedicals include pharmacists, but you don't need to worry. Actually, what I used to say every time in Tirukural, that is a couplet written 2000 years ago by a Tamil poet. He has recognized pharmacist that in a couplet he has said the part medicine. The part medicine has four parts. Four parts are compiling one physician, one patient, and one pharmacist, and a drug. So these are the four parts of the field of medicine. So the role of pharmacist is already recognized 2000 years ago, and they are usually, our Prime Minister used to talk about the couplets in every meeting, that Thiruvalluvarji has told this and that. One day he will also say this Tirukural, that this is made of four parts. One part is pharmacist. Every therapy has 1/3, 1/4 as role is played by pharmacist, and 1/4 is by the drug. So totally 50% is occupied by our side, and 25% by physicians, 25% by the disease. So this is the field of medicine. Don't worry, we will get the day. That particular Tirukural will be recited by our Honorable Prime Minister very soon. We will be recognized. We will feel that we will be recognized by the Government of India.
Absolutely.
So don't feel that.
Fantastic, fabulous. And what I believe that if you, the respected Dr. Balan said that 50% of the responsibility is with the pharmacist for the drug dealings, and very soon the people will start recognizing this also. एक बहुत कॉमन डे टू डे लैंग्वेज आजकल सुनने मिलती होगी टू स्टूडेंट्स ऑल्सो, टू टीचर्स ऑल्सो, टू एवरी फार्मासिस्ट ऑल्सो, जो उनके नॉन फार्मेसी फ्रेंड्स हैं, दे कीप ऑन टेलिंग देम, अरे यार तुम फार्मेसी वाले वैक्सीन कब बनाओगे? ऐसा सबके साथ हुआ है कि नहीं हुआ है? रेज हैंड.
Yeah, they look on the pharmacists. When are you going to deliver the vaccines for this disease? When are you going to give the tablets for this disease particularly? They are looking upon the pharmacist now. You are rightly saying, but I think you can check your connection now. Your video is hanged. Jayesh, sir, please check your connectivity. Are you hearing us?
We lost his connectivity. No, he joined again, sir.
This is
yes,
what
sir.
I was.
Sir, there may be some connection issues, I suppose.
Yeah.
Yes.
Please start your presentation again.
Okay,
And
okay,
you,
okay.
you may please carry on.
The presentation is visible, sir?
No,
No,
sir.
not now.
Not
Okay.
yet.
Somebody needs to have 6-pay commission. Rohit Pandey.
Yes.
Now is it visible?
Yes, sir. Make it a slideshow and you may carry on.
Visible?
Yeah. If,
Okay. So my
if
thanks
both
to
if both of us are discussing,
chairman. Yeah.
then people will think that principal want to talk to Jay sir. That's why he called. We may leave the meeting. So 77 has come to 71 now. So you may please carry on with your lecture. We will talk later.
So thanks to Dr. Balan sir, also Dr. Gurpreet Singh, and all my faculties who were already my ex-colleagues at one point of my career. It was amazing time. Now, what is the meaning of these three terms? Pharmacist, frontline, and warrior. So everybody of us know what are the pharmacists. As sir also described, we are the people who handle drugs, right from its birth to the administration to the patient. All right, so we need not to explain it much about the pharmacists. So now the major terms becomes the frontline and warriors. So frontline obviously border पे जो खड़े हैं frontline. Warriors, the person who will protect us, protect our rights, protect our lives. So to explain it in a more elaborative way, the front line, more emphasis to be given to the term front line, because as I already told you, despite of such a commitment from all the fellow pharmacists throughout the country, still we are not recognized as the front line warriors. So for that we need to, I think, submit certain data also to the regulating agencies, to the governments also, that we are the people who are doing frontline, and that will be the part of the most of my talkings in the presentation. Warriors, as I already told you, the people who are fighting for the sake of our safety, these are warriors, and none other than a pharmacist can be called as warriors. I'll take the example of, first of all, hospital pharmacists. What are the hospital pharmacists and how can be they called as frontline? There are a few examples. If people are only looking at the physicians, nurses. If we talk of hospital pharmacists' contributions in COVID-19 management, we can have certain n numbers of things, but to summarize, we can have few points like participating in inpatient rounds. See, none of the, I have got reports from many of the private hospitals also that none of the nursing staff goes to the patient to administer the drug. So finally, they come to the pharmacist, it is your role. Now they are telling the pharmacist to go and give the medication to the patients. Because of jaan pe ban rahi hai, to pharmacist yaad aa raha hai. So why not to get the tag of the front line? Because the pharmacists are going and giving the drugs to the inpatients also. So these are the things which we must jump upon. Certain things humko aaj grab karni padegi, looking at the opportunities. Then second thing, ensuring sufficient medication supply to support ICU beds. We know Delhi mein abhi kis tarike se, again it is a second wave going, the ICU beds are more and more ICU beds, and with every bed you need a pharmacist. That is for sure, because the scale of the infection is different to every patient, and for every patient there is a different scheme of treatment. You know that there are 3 or 4 drugs which are being prescribed in combination or separately to the patient. So it is the pharmacist who decides in consultation with the physician that which drugs to be given, which drugs not to be given, which drugs to be stopped. So we have definitely a big role as a hospital pharmacist, need to be acknowledged. Then the managing critical drug shortage through implementation of conservation strategy and sourcing. Modi government at the outburst of the corona, so first of all taken the data throughout the country, how much quantity of hydroxychloroquine we have in our country. So the data was provided by pharmacists to the central government, and rest of the, when we assured that we have sufficient quantity of medication available with India, then we started thinking of exporting that drug to the other countries. So who gave the data? These were the pharmacists who gave the data that how much we have or how much we can provide the patients in this pandemic time. Next, planning and responding to prevent pathogen outbreak. Everyone knows how a better medication can allow stop the pathogen outbreak. Developing local treatment protocols that repurpose antiviral and monitoring the use of antibiotics. Antibiotics are obviously given along with this corona medications. So the proper use of antibiotics so that the patient does not becomes resistant also. It is also monitored by the pharmacist also, hospital pharmacist also, helping in interpretation test results. Very important. Although physicians are always consulting with the pharmacist, that this is the reports, what is the medication we should give. So we are already neck to neck with providing the services to the patients along with physicians. Important thing like potential treatment options like hydroxychloroquine, methylprednisolone are being evaluated in clinical trials only. These are the old drugs which are being prescribed for other diseases, but these are evaluated as antiviral capacity in clinical trials itself. So it's definitely a role of a pharmacist. Let us talk about community pharmacist role. Again, everybody knows that the patient first of all goes to the medical store in case of a normal or halka fulka could be indication hoga, so it will definitely go to the pharmacy store before going to the doctor. A community pharmacist definitely, in my opinion, it is a frontline warrior. How a medical advice without cost to patients who are unable to afford physician fees. Everybody knows the patient goes to the medical store first if he has got a very minimal kind of infection or kind things. So definitely those patients who cannot afford the fees of doctors definitely go to the pharmacy store, and there they get the free advice. Despite the initial shortage of personal protective equipment, pharmacists continue to provide direct patient care. This we all know. PPE were provided to the nurses, to doctors, to all, but very few PPE were provided to the pharmacy people. This discrimination has been taken up by the pharmacists despite saying anything. So we must ask for all equivalent privileges from the government of India. Pharmacies are delivering medications to patients free of charge, as I already told, assessing patient requirements that require renewable chronic medication. There are certain patients who come for corona, but they are already being treating with diabetes. Also, we keep on continuing their prescriptions without taking any charges. So these are all the, and there are certain other dimensions also which tell us about frontline community pharmacists' role to be acknowledged. Now we should talk of how much the mental burden a pharmacist takes during all these activities. See, a pharmacist role in case of COVID-19, we can classify it through certain points. First point of contact in a pharmacy store is definitely a pharmacist. All right. Information. The second, the thing which is expected out of a pharmacist is the information. Then he should manage the shortage management in hospitals as well as in its store. Then there are various consultation procedures which a pharmacist takes up. Consultation throughout the job, other than job also. Screening procedures also we are being employed. All right. So all these things leads to increased workload of a pharmacist, and at the same time we are very much at the increased risk of infection. This is not the case that pharmacy, and we know that the pharmacy stores were open throughout the COVID lockdowns also. These are the pharmacy stores as well as some of the food items and milk stores were only open. And we found that many of these milk people, the departmental store people got infected, but no one no one has declared how much pharmacists have been infected. Many deaths have already been taken up of pharmacists throughout this pandemic. So increased burden and stress definitely have taken the toll of the health of the pharmacist. Definitely it has to be acknowledged. It has to be acknowledged. How we can say we are frontline warriors until we will provide these data to the regulatories. I will wish to share another slide regarding factors affecting a non-prescription medicine. The over-the-counter drugs the patient लेता है, so these are the factors which decide कैसे वो choose करेगा एक non-prescription medicines को. So there are certain percentages Number 3, if we see the advice of a pharmacist, 27% is the role, the advice of a pharmacist by which a patient chooses a non-prescription medicine. All right. Well, so मतलब 27% is almost 1/4 of the advice. मतलब 1/4 उसका advice का role है. There are other factors also, like 14% is value for money, 37% I know it is safe. The patient know it is safe. So how he knows that it is safe? It is through the patient pharmacist counseling only. 36% I know it works. How he knows? He knows by the pharmacist counseling only. So basically, इसमें 27% दिख रहा है, but we can say that around 75.
I think the connection of Jason has been lost.
I think there is a lack of connectivity.
Yes, sir.
Yeah, he is joining again.
Joined again.
I'm sorry, connection issues.
No problem, sir. We are in India.
Thank you, sir.
What I mean to say is our people are very patient.
Yes, sir. People are very patient, and I recharge भी आज सुबह किया था. It is giving me problem. I don't know. 2 lakhs of industry pharmacists. See, the role of the industry pharmacists also need to be very much acknowledged, because these are the people who are working day and night for the vaccines. All right. So we must be acknowledged. Teachers and academicians very much to be acknowledged. There are around 50,000 teachers who are working, who I don't know, many of were not aware of online teaching platforms, but they all learned it. They all started giving education to the pharmacy institutions, pharmacy students through their online platform. The way they could have managed it, they have started giving, they have started counseling. So we must acknowledge these pharmacists also, which are working day and night to give a strength of new budding pharmacists. As I already say, hospital pharmacists, and we should also recognize the role of somewhere around 2,000 regulators, pharmacy regulators, which are working day and night along with the central ministry. So when I say regulators, we must provide certain data to these regulators who can transfer this information to the government of India, that how much we are a part of the healthcare system. We must be acknowledged as a part of the healthcare system. Another slide which I found somewhere and I want to share on this platform, that self-care is increasing in India. By this I mean that self-care has already been started a decade ago, but now it is gearing up. Self-care means now more and more of yoga, more and more of medication, a timely starting of medication, a timely starting of self-checkup along with self-medication has started, and it's becoming culture in India. So here a role of pharmacist also can be considered and should be considered. What I mean to say is that when we go from left to the right in the screen, so a pure self-care, it is the responsibility of the individual, and the pure medical care to the right is the responsibility of professional, the pharmacy and the healthcare professional. So once we go from the healthy living to the in hospital care, it is the role of the pharmacist throughout the channel. Like when he starts from the medication, he comes to know at the early age or whatever the age, he comes to know that I may get the following diseases. I may get the diseases. Now the treatment has gone to I have the diseases from I may get the diseases. ये आजकल ट्रीटमेंट प्रोफाइल हो गया है. लोग बाग टाइमली टेस्टिंग करते हैं, चेकअप्स करते हैं, and they get to know the near future I will get this disease. So for that they have started self care ऑलरेडी ये एक बहुत कमिंग जो है, दिस इज ऑल्सो गोइंग टू बी अ काइंड ऑफ न्यू हेल्थ केयर सिस्टम। एंड इंडिया में इतनी बड़ी पॉपुलेशन को देखते हुए एक बहुत बड़ा रोल है फार्मासिस्ट का, एंड वी ऑलरेडी आर डूइंग इट। एक फार्मेसी का जो काउंसलिंग है, फार्मेसी मेडिकेशन प्रोवाइडिंग जो करता है, it is already doing it. It is just to be get financially backup also. A procedure has to be made by which we can get some financial.
Yes, sir. You are now audible.
Yeah. So it is a big population which can give us a lot of financial encouragements also, if we look at this side of the medication. A few of the quotes which I found in recent times in the newspapers. Prime Minister Modi's vision says that PM मोदी ने कहा, मुझे भरोसा है कि जैसे भारत दुनिया की फार्मेसी का केंद्र बन गया है, वैसे ही परंपरागत चिकित्सा पद्धति का केंद्रीय स्थल भी बन सकेगा। So self medication includes all kind of herbal medicines, yoga, as well as medication, allopathic. So we need to develop our different dimensions also of medications. If we look at the different paradigm of healthcare system. Then I will come to some of the innovations example, which also I find in one of the newspapers in Diwali time. 30 seconds में कोरोना खत्म करेगा plasma jet. So these are the innovation examples which pharmacy students, upcoming students or research scholars must find to get the people more and more benefit out of their research. We are doing research, but what should be, the research should be benefited to the society. तो इस तरीके का एक जेट, कोरोना जेट बनाया जिससे 30 सेकंड में सरफेस का जो कोरोना है वो डिस्ट्रॉय हो सकेगा, एंड इट इज बीन डेवलप्ड बाय 3D प्रिंटिंग. आर्टिफिशियल इंटेलिजेंस इज प्लेइंग बिगर रोल इन दीज डेज. दिल्ली की एक न्यूज थी, बाजार में ही गोंद गिलोय वाली इम्यूनिटी बूस्टर मिठाइयाँ. So herbal medicines are used along with mithaiya also. So innovations for common people use. More and more people use such kind of mithai इस बार, जिसमें गोंद और गिलोय वाली इम्यूनिटी बूस्टर एडेड है. ये अभी रिसेंट न्यूज है इन दिवाली टाइम. We have many pharmacognosy participants also. I can see Praveen ji smiling. Wellness industry, as I told you, this is also a news cutting which says that in another 2 years, the wellness industry will reach around 410 lakh crores. 410 lakh crores. It is a big part of the healthcare system. So we need to emphasize all these things also, that how can we enhance the existing dimensions of our pharmacy stores to add on to our financial benefits. इट इज अनदर मोर इम्पोर्टेंट न्यूज. चीन को छोड़कर भारत की ओर पिछले 20 साल से चीन, वी ऑल नो दैट रॉ मटेरियल API, द चाइना वाज द ऑन द टॉप, बट आफ्टर दिस कोरोना इट हैज बीन प्रेजेंटेड दैट people are avoiding China, and obviously the second choice is India. So we are expecting that we must be self-independent in case of API also, as well as in case of different medications also in another 5 to 10 years of time. These are one of the Bengal people have shared. These are the pharmacists who died during Corona by serving the societies. So this is my wish that we must also get some of the data. This I already discussed with various platforms also, that we must get the data of our fellow pharmacists who died during this pandemic, and we must acknowledge their family, their contribution, and we must at least send some of the wishes to their family members. Thank you, Gurpreet.
Thank you very much, sir, for your brief and wonderful lecture. And this is not the lecture only. This is the information that you have provided to all the students about your front line. The main aspect is that the front line warrior. So thank you very much, sir, for the valuable time sharing with us. And welcome back once again in Alva Pharmacy College. We always miss you a lot, and it is always pleasure to meet with you and talk with you, sir. So over to you, Jayapalan, sir.
Yeah. Thank you. Actually, today we have the pleasure of having Dr. J.S. Dwivedi back in Alva Pharmacy College. He has come back with a bang and a blast that why don't we call ourselves as frontline warriors? We are all in frontline and we are the warriors. So he is a very motivating speaker, and he is a leader for the teachers of Rajasthan as the Vice President of Association of Pharmaceutical Teachers of India. So an enthusiastic leader is motivating the future leaders of Alva Pharmacy College, and we are pleased to have you again, Dr. Jayesh. Today we have completed 2 successful sessions, one from Dr. Monica Jain and one from Dr. J.S. Dwivedi. Both are in different dimensions with different perspectives. It was very, very wonderful. And if any of our student wants to ask any question, you may please ask. I may even now allow you to unmute yourself. So you can unmute yourself and ask the questions. I change the view into gallery view. You may unmute your mic, camera, so that we can have a screenshot also. And I will
all are students of Alva Pharmacy College, right?
Yeah.
A big congratulations to everyone who is attending the seminar, as well as who not be attending, the students and the staff of Alva Pharmacy College. I have been associated with these people, and I must say that that period of my career was the most unforgettable time I shared with my fellow colleagues.
Same here, sir. Same here, sir.
And I don't miss any opportunity to be there, online, offline, doesn't matter. I don't miss any of the opportunity to be there, to take the blessings of Dr. Balan sir and everything. Yeah, you can ask any of you if you have any question, you can ask.
Sir, one of our faculty member has asked one question. Does sufficient ventilators and vaccination going to halt pharmacists' frontline role after pandemic ends?
Pharmacists?
Does sufficient ventilators and vaccination going to halt pharmacists' frontline role after pandemic ends?
After pandemic ends?
Ends.
Okay. So what I got is, do we will able to get the vaccination for pharmacists or not?
Yeah.
I can even give a suggestion that why don't Mohammad Adil unmute himself and clear his question. The question is a little bit vague, I think.
Yes.
Adil, if you can unmute your mic and talk to Jay sir, he can understand it better and answer.
Yeah, Adil.
What do you want to ask, Mr. Mohammad Adil? Are you?
Yeah, he's there. Adil.
Hello, sir. I'm audible.
Yes.
Yeah, you are audible. You can ask your question.
Hello.
Yeah, tell me.
His connection.
Sir, what I think he wants to ask that is the sufficient vaccine will be available to all the fellow pharmacists once the pandemic is over. This is what you want to ask, Adil?
Yes, sir. Yes, sir.
See, once the vaccination starts, I don't think the pandemic will be over very soon. The vaccination will go for few years because such a huge population. If you want to organize, and recently we found a study that the vaccine of Pfizer, which is going to be in the market very soon at the earliest, needs a very good cold chain system, which India still don't have. Cold chain system चाहिए उसके लिए. It has to be preserved at -50, around -50 degrees. So for that we need a cold chain system in India, which is government is looking के उस वाले वैक्सीन को ज्यादा अफोर्ड कर पाएंगे या हम भारत वैक्सीन वाले को ज्यादा अफोर्ड कर पाएंगे. So for such a big population, I think we need to take different vaccines available for different age peoples also. And still, once the vaccination is done, I don't think the pandemic will be over very soon. The pandemic will be there. Just like swine flu, we have forgotten swine flu, but the swine flu still exists. Swine flu अभी खत्म नहीं हुआ है. हम वो अलग बात है कि हम भूल गए कि swine flu है. तो इसी तरीके से कोरोना में भी होगा. Once the vaccination is there, हम मेंटली इजी हो जाएंगे कि चलो ठीक है वैक्सीनेशन हो गया है. But corona will be there in the society. And regarding pharmacists, regarding the availability of vaccine to the pharmacists, Government of India somewhere has given some hints that it will be available free of cost to every citizen of India. So obviously pharmacist तो definitely उसका एक पार्टी है तो vaccination हो जाना चाहिए.
Yeah, definitely there will be a protocol. Actually, we will identify first of all who are the frontline warriors and who are vulnerable to the disease. And that group will be given the immunization first, and then they will go for a normal citizen. And India, especially, is an young country. The most of the population is between the age group of 20 to 50. So we are not getting easily affected by this disease. So correct. we can have a very few vulnerable community in India. So that community can be first immunized, and the frontline warriors, and then the normal citizens. So it will, the God has given enough time for us to prepare and immunize all the citizens of India. Don't worry, pharmacists will be safe. Okay.
Yes, sir. Yes, sir. Yes, sir. Yes.
So anybody else wants to ask any question? No. Then we may proceed to vote of thanks, Dr. Gurpreet.
One thing more I want to add, sir. I was looking at the overall program of the National Pharmacy Week. This time, very good initiation of collecting the expired medicines throughout the Alwar region. You have planned right now, last day.
Yeah, that is our activity. We have started collecting the unused and expired medicines from the common public of Alwar. So we are going to segregate it. If it can be used again, it will be submitted to the government hospitals. And if it can't be used, if there is no label, if the drug is expired, then we will be safely disposing it according to the protocol suggested by the WHO as well as the FIP. So we are going to follow this, and we are going to work with the authorities and NGOs for this purpose, for the safe disposal of drugs. So this is a small initiative, but effectively started yesterday. And yesterday, some of our faculties have gone to the field. Dr. Wasim Akhtar and Ms. Neha Sharma. How was the experience? If you can share in 1 or 2 words, we can also incorporate in this platform. Yes. If the Dr. Akhtar, if you can share the field experience, how was it yesterday, how our students were cooperating to you in Alwar, because we are not calling students to the college. We are meeting the students in their residency area. So we are getting the help of the students from their residence. And I asked all the students to collect unused and expired medicines and submit it to the college separately also. Even if the student is in Bihar, he can collect it in Bihar and he can submit it somewhere else that we are identifying and informing to them. Say, for example, Sripati Singh sir is there in Bihar. He can collect it and dispose it safely on behalf of Alwar Pharmacy College if we go and request him. If there are any student in Bihar needs such kind of help, we can contact Mr. Sripati Singh sir and we can ask for helping the disposal of drugs. We can do it. So how was the experience, Dr. Wasim, yesterday?
सर एक्चुअली हम लोग जितने भी टीम से गए थे तो सारे स्टूडेंट जैसे जसप्रीत, हरप्रीत और ये सारे स्टूडेंट 5-6 स्टूडेंट आए थे। एक्सपीरियंस बहुत अच्छा रहा और रिस्पॉन्स भी बहुत ही अच्छा रहा लोगों का। और जैसे हर्षदीप भी आया था और वो लोग भी मेडिसिन लेके आए थे, बहुत ही अच्छे लोगों ने बोला बहुत अच्छा काम है, ठीक है। और मेडिसिन भी मुझे बहुत लोगों ने दिए और कलेक्ट किए हमने। और सर आपका ये है कि अभी दिवाली की वजह से थोड़ा सा डिस्टरबेंस ये हो गया कि दिवाली में जो है लोग घर की सफाई कर रहे थे, तो जिसमें वो उनको अवेयर नहीं थे, तो मैंने उन लोगों को अवेयर किया। जो अब नेक्स्ट टाइम मैं आऊंगा या हमारी टीम आएगी तो वो आप उसको रखना, हम लोग सेफली डिस्पोज करेंगे। तो बहुत ही अच्छा रिस्पॉन्स मिला हमको हर जगह से।
Wonderful.
Thank you. Who was the another teacher? I think Neha.
Neha ma'am.
Yeah. Neha, what was your experience yesterday? How was the people responding? She is not there in the group.
Yes, sir.
One of the person I know, sir, by the name Medicine Baba. Medicine Baba is there. I think in NCR region he is working on the same line. Anybody has the expired medicines or unused medicine, he goes and collects, I suppose. And he has made some point where people can go and give him the unused medicine, and he gives to the person who are need or who cannot buy. So this is a very noble initiation by Alwar Pharmacy College also. That
that is what is in our mind also. Even though it is started for the purpose of National Pharmacy Week, we plan to install some collection points in city. So that the people can voluntarily go and put their unused and expired medicines in the boxes that we can collect in a weekly basis and dispose it safely. So 2-3 points identified, especially our known people who are running pharmacies, who are running other businesses. So say for example, Nitin Jumnani is running, their families are running electronic shop in the Gantaghar. That is a peak important area, heart of the city. If we can keep 2 boxes for collecting the drugs, if the people started using the bin for throwing their unused medicine, it will be very useful for us to safely dispose those. We will definitely do the activity in continuous manner. Thank you for remembering and recapitulating in this occasion, Dr. Jayesh.
Thank you, sir.
Thank you very much. And I think we have taken much of your time today. Thanks for your time. Thanks for your knowledge shared. Thank you for everything.